Hi, can you see us? We're about. Okay, perfect. Yep, sounds good. Thanks. Bye. Okay, we're live.
We ready? Mm-hmm. All right. Well, good afternoon. Thank you for coming in again today. Yesterday, after we left talking, you heard that there were 3 cases of coronavirus in Cuyahoga County. Again, we have no cases in Lucas County. We are continuing to, again, send the message out about what we want to see in our community. We talked yesterday about, again, let's stop shaking hands. Again, those elderly individuals and individuals with underlying conditions, diabetes, other health conditions, really should stay away from those mass gatherings. Try not to go out shopping during the day when there's a lot of people in the grocery stores, those types of things. I'd like to talk to you today about mass gatherings. We really need to start looking at the idea of those non-essential mass gatherings, what they are, and possibly not actually attending those or having those mass gatherings. Again, it's just every time that we can stop the spread of the disease to somebody who is immunocompromised, is elderly, the more lives we can save. So again, I want the community to kind of start thinking about that and understanding that a way to, again, slow down and or eliminate some of the spread of this disease is, again, by not coming in close contact with other individuals. You heard recently about Columbus and OSU and what they're going to try to do here until the end of the month about, if you would, distance learning. Again, those are some of the steps that are being taken in other communities. And just to let you know, our community is working on some of those same ideas, as well as just had a meeting with hospital representatives from the community. And we're looking at ramping up some things relative to coronavirus and response in the community, but more to come on that. Again, I want you to make sure that you understand that this community is prepared as well as it can be at this point in time, and that as scenarios and situations drive us, we will respond to those. And just making sure that, again, this community is as healthy as it can be. If you see behind me, again, I want to draw your attention to a couple of the conferences, the American Israel Public Affairs Committee, and of course the CPAC convention, as well as those couple countries that we still have some travel advisories with. These are those either the conferences and or the countries that we are concerned about people coming back. If you've attended those, if you've been there, again, it really should not be out in public. You should be self-quarantining. If you have questions about the conferences, let us know, and we can go ahead then and help you through that. Again, I've had a couple calls today from individuals that have attended those conferences, and they're already saying that they're going to be staying at home for the foreseeable future relative to coronavirus. So, I think with that said, I really want to stress the idea of us thinking about those non-essential mass gatherings and what are we going to be able to do about those, what they are, and work through that situation as we progress over the next days to weeks with the coronavirus issue. So with that, questions?
What is defined as a mass gathering?
I'm sorry?
What is defined as a mass
Again,
gathering?
that's a good point. There's been some literature out there. Anything over 100 would be considered mass gathering. I know there's other places in the country that are considering 1,000 as a mass gathering. I would really kind of consider this community to start looking at things of 100 or plus possibly. Again, just to start thinking about it and understanding that that is an issue that we're eventually going to have to face in the community, and really start thinking about what that means to those organizations that have those mass gatherings. So,
all right, now,
please.
How long are we taking? Because we've got proms, we've
yeah,
got graduation,
I understand.
We've got a lot of end-of-year events. So help us through that. What do you see us having to have alternate plans for?
Well, again, as we've been talking about mass gatherings, talking with UT, some of those officials there are looking at basketball games and things of that nature as mass gatherings. We hear on the radio and TV about NBA, actually not having patrons there, spectators at their events. So those are the type of things we're looking at. The idea of proms and things of that nature, as we go through, as we get closer to those, we'll be able to talk more about them. Again, it all depends on, too, what we have in the community at that point in time or in the state relative to diseases. The problem that we're having right now is that this thing keeps on, shifting because we progress more into this disease state or the state of where coronavirus is in the outbreak. So, the possibility is if we, start curtailing now, we might see a shortened amount of time that we actually have to curtail events because that virus will then kind of run its course. But again, we don't know that. So I think the short answer to your question is we're going to need to take those case by case and see at what point in time they're at, and then the amount of a person or people who might be at those events. So.
All right, reasonably, do you see us following suit and maybe having our students stay home at colleges and universities? Would that possibly, let's answer that
Sure.
question first.
Sure. I think that, again, really impressed with UT and the steps that they've taken for not only for their students but for this community. I think that they're probably talking about that very issue again. OSU has done it, so I'm sure those other universities and colleges are talking about that right now. Again, I'm like I said, I'm very impressed, and I'm very positive that UT, whatever they do, is going to be the right thing for the community. So.
Do you see that filtering down to K through 12 schools?
That's a great question. Again, it could. Again, this is all scenario driven. Again, if you think about mass gatherings and then the spread of the virus, because we've limited those mass gatherings, possibly that virus doesn't have the ability to jump somebody else. So again, we may not have as much of an issue with schools if we can maybe stop things before they actually start to grow. The idea of, again, school systems, again, let me take a step back with this. Superintendents have been great. They've been calling me. We've had meetings. They've pushed out information. They're on top of the situation in this community. I don't know about other counties, but in this community, I'm impressed with what they're doing with their kids. And they're in constant contact with us one way or another. Either we're pushing things out or they're calling to make sure what are we going to do. They've talked about, again, we've had blizzards, those blizzard bags, again, being able to have school at home possibly. Again, these are things that they're working on. I'm not saying that we're going to that, but I think the community needs to know people have not just been kind of sitting waiting to this moment. There's been a lot of talk and a lot of planning by a lot of great people in this community to make sure that we can respond the best we can. So.
Are there any other protocols that are now in place since the press conference yesterday, now that we know there are 3 confirmed cases in the state?
Again, I think what we're trying to do, protocol-wise, is make sure that we're in front of the community to say, this is what's going on, this is where we're at, and this is what we need to do. Again, if the community doesn't understand kind of what they need to do to keep themselves healthy, which then keeps their neighbor healthy, then all this is for naught. So it's important, again, to make sure that communication information gets out. So that's kind of what we're stepping up.
Let me ask you this.
Mm-hmm.
You did mention that we have local people who went to those conferences that you have written on the board behind you, and they have self-quarantined in our community, correct?
Mm-hmm. Yes.
Okay.
Yeah.
Have any of them shown any?
No.
Have they been tested?
I don't know that yet. I don't know that, but I know that they have no symptoms. I know that. So.
Okay.
Where are we at with test kits locally?
Good point.
You spoke a little bit about we're doing more testing in the state, but what about locally here?
Again, the test is a little bit of an issue for us, and I don't want us to go off the deep end with that. There's protocols in place to make sure that the test that Ohio Department of Health has, those are for the most critical individuals, and then for clusters, I think that still holds true. The idea about labs, they're coming online, so there's ability for doctors then to go ahead and utilize those private labs. So that there's some ability out there. Again, but you still have to go through some criteria. Just because you think that you might be sick, you're not going to get tested right now.
Okay. So
Again, without some other things,
what
travel,
I'm
things
hearing
like
from
that.
you is that we have limited testing
Right now,
available in
right?
Ohio.
Yeah.
Okay. Another thing that it seems to be what you're saying is that the more restrictive we are up front of this, the less chance we have of this spanning out
Correct.
longer.
Yeah, and you make a really good point. I think that's what we're trying to stress here is that the less virus that is passed between us, or the less likely it is to be able to pass between us, the better off we all are. Because eventually that virus is going to run its course. It's not going to be around. It doesn't have the ability to jump from person to person, so it can't survive. It can't live. So that's kind of why we keep on saying if we can extend the amount of time that the virus is not in our community, the better off we are, because we might be able to get to a point in the year where, again, I don't want to get too much in this, but it's warmer, there's more moisture in the air, that virus isn't as easy to get into us, or that we're closer to a vaccine the end of the year, beginning of next. So there's a lot of things that play into this. I think the main point is that the less virus that we have in that community, the better off we all are. And again, I want to stress that I've had this question posed to me a couple times now. Eric, this isn't affecting the younger kids, or younger people. Why is it such, why are we making such a big deal about it? And thank goodness it's not, because I would hate to see my kids or any of our kids, come down and be sick. That's terrible. It's bad enough for an adult. But we got to remember, this virus is really attacking those immunocompromised and those elderly. And that's what we're trying to do here. Even though the kids may not be getting sick or showing sickness or having, a mortality rate, we still have a mortality rate with those older individuals. And so that's what we're trying to do here, is we're trying to help the population that is most affected by this. If we can, again, we can do some things to slow down that virus from getting into those individuals, the better off we all are. Again, this is really about trying to make sure about saving lives in the long run. The more we do, the more hand washing we do. Again, somebody kind of made a joke to me the other day about hand washing. Eric, you're always talking about hand washing. Yes, I am always talking about hand washing, because again, that is our best defense against this disease at this point in time. Keep these things washed, proper hand hygiene. Again, we've talked about this. Don't blow your nose and not throw out the Kleenex and then not wash your hands. You've got to do those things. And the big thing is, don't be around sick people, especially if you're immunocompromised or in that bracket that we've talked about, that age group. You just don't want to be around sick people. If you're sick, again, stay at home. So again, messaging now so that we don't have an issue later on with messaging. And I don't want to surprise the community about what's going to happen or what could happen. This community is going to know as much as I do when I can get it out to you guys. All right? That's really important, I think. Please keep up this good work, too, with the media. I'm happy that we're getting the message out. We need to continue that. So. Anything else? Anything? All right? Thank you so much, everybody. Appreciate it. Okay. Are we off? 2 o'clock. Pay attention to what's going to be said at 2 o'clock.
Sent to us?
There should have been a press release from the governor's office. Pay attention to that, please.
At 2?
At 2.